Moving on, the Minister of State for the Federal Capital Territory, Dr. Ramatu Aliu, has announced that plans are at advanced stage to relocate communities such as Jabi-Yakubu, Jabi-Samuel and Mabushi to Shere Community. And the verge of factual reportage, KAFTANTV crew took a trip down to Shere Community to assess its rate of economic development and examine the effect of the resettlement policy on the community. Chidimao Fomadu has more on this story.
The Federal Capital Territory, Abuja, is a combination of various settlements, communities and cities with unique and diverse ethnic groups. Amongst these is a community with approximately 900 hectares of land and a population of over 3,000 people called Shere Community. Shere is a relatively small community with a distance of about 16 kilometers, which costs 700 naira from Buhari Area Council and 7 kilometers costing 300 naira to Bapi town. The journey to Shere Community was an episode of a rocky outing, paving our path through a sooty route submerged with clay soil fillings and potholes. Being a novice in the area, driving down this untarred road could stir up scary thoughts as a result of the lonely and bumpy path. This is a candid explanation of the route leading to Shere Community, a commuter belt in Buhari Area Council of the Federal Capital Territory. Based on a resettlement policy, the Minister of State for Federal Capital Territory, Dr. Ramatu Aliu, stated that plans are at an advanced stage to relocate indigenous communities such as Jabi-Yakubu, Jabi-Samuel and Mabushi to Shere Community in a bid to get rid of slums and prevent the already perceptible slide into urban decay. On a mission of factual reportage, KAFTANTV crew took a trip to the community to assess its rate of economic development and examine the effect of the resettlement policy on the community. Our crew was welcomed to the community by the chief at his palace, where we had a meeting with some of the leaders in the community as they relayed their thoughts on the resettlement policy.
da ake ce za a kawo mutane daga nan shirya aka gina musu gidaje.
He said now it's roughly 15 to 20 years that the settlement scheme project was sent to be conducted here.
To gidaje da aka gina dai na ganin su kusa hudu.
The house scheme that was consulted, he think if he cannot make a mistake, is up to 40 units. Is it 400 units, go? 4,000 units.
So, kuma har yanzu muna ji za a ce kullum shekara za a turo mutane su zo.
Since then, those that I marked to settle here have not come up to date.
Kullum sai a ce abun ma mun gaji da abun.
And we are tired of hearing that always.
Saboda haka,
for that,
mun gwamnati abun da ta ce za ta yi ita su ne idonmu.
Whatever government have decided, we have no option to say we are rejecting them.
Ba abin da za mu iya ce musu ku kawo ko kuma kar ku kawo. Mu dai mun da mun ba su daji cewa su kawo mutane mu yanzu muna sauraren su ne.
The chief imam of Shere Community, Mohammed Alura, who served as the interpreter for the chief, explained that Shere Community was faced with a lot of infrastructural challenges which has impeded its economic development. He noted that the community, which has made written demands to the government, had not been compensated by the government as they demanded for good health care, restructuring of their primary school, pipe-borne water, electricity, a graveyard to bury their loved ones, amongst others. Shere Community has lacked electricity since 2012.
Then, in terms of road network, I know you are from there. You have seen it with a nickel eyes. We need not to say much, but in terms, we in this kingdom we need network. We need road to be tarred, because these are some of the conditions that even those that are about coming say it openly to the hearing of the government, that they will not come until when the government tar this road. Then from there, we also need more boreholes, no electricity. The what do you call it? The poles you saw is the senator's constituency project, but and since they installed the borehole, and I mean the poles, up to now there's no light. We are running. I passed my neighbor. As a witness now, this is an NC program that is going on, and we don't have light. At least being we have light, we only plug it here and go ahead with it. So we are using torchlight, local what do you call it? Local lamps. And I passed my neighbor. I passed my neighbor. The wells we dug from our different houses is the one we are using. Critical example, if you go into the chief's house now, you will see a well. At the back of the house. If you go to my house, you will see a well. If you go to this man's house, you will see the same thing applicable to these people you are seeing. So we don't have potable water. It is our hand what do you call it? Hand dug well that we dug that we are using. We have clinic. We have an abandoned hospital that the government started consulting. How I wish you would go there and even very good. How I wish you would go there and see with your little eyes. In fact, if that what do you call it? If that hospital can be consulted, we are okay. We run only on clinics. If there is any emergency that demand this will go to Gwari or the town. People have no clinic that will serve the purpose now. We always go to general clinic, general hospital in the Gwari area council, then or private clinic or Kubwa. If woman is in level like you, if you are my wife, if you have pregnant, if you want to say if you are in labor, immediately we get to our clinic, and the matter is above her or above him. I mean the nurse to refer us to either government hospital. In our own what do you call it? In our own decision, we will see that because at times if you go to Gwari, you will have no bed. Then we will go to the private ones.
One of the leaders in the meeting, while laying emphasis on the agricultural sector, said that it is a major source of income for the residents of Shere and complained that the resettlement might lead to conflicts if the farmlands are not appropriately allocated, as most people would not have farmlands to farm.
And other activities land, they were not able to do that. So when you look at the area that they have occupied the area, and secondly there is a farmland here which has occupied. We don't have any other place now. Even the farming now, people that are farming, most of us are farming in that farmland, that resettlement area. And eventually, if they will come today, most of us will not have where to farm. By the way, if those people will come and resettle here, there will be a conflict. Hence, there are farmers. So the issue now is either government should look for another land for them to come and settle them for farming area far away from the remaining one in our own. Either they should revoke the farmland and give us to farm there. So, me, this is the way I see to avoid conflict between them and us. And secondly, I still want to recall back on our agreement with them. We told them about our palace, we told them about roads, we told them about primary schools. If you can go to this primary school, have insufficient classes there. Secondly, the hospital. If you can carry a woman, it was 2 weeks ago. We took one woman in the night. We didn't beg for a vehicle. We reached Gwari. It was around 3 o'clock. We left here 11 o'clock. In the night. Just for this cholera, one Fulani boy there behind us. They took him around 9 o'clock. When rain falls, we have nowhere to move. No road. So they need about along the way, carrying one boy died here. Day before yesterday. No road. When rain fall here, in fact, we are just inside well. So please, if government will take care of this, especially the hospital. If you look at this hospital, from with people living around here, more than 50-something places, and we depend on this hospital.
Clinic, not clinic, not even
primary health care. And there is no sufficient doctors there. Only one. Only one. One nurse. So sometimes you can go there at 12 o'clock, you are not seeing anybody. Nobody. The 7 o'clock, nobody. If she's absent, the hospital is absent. So this is the problem we are facing a lot. And the issue of water. It is only this whole water. It is not working. Most of us, not all people that have this well, we use clean water.
Shere Community has one primary school which serves about 3 to 4 settlements in the area. Taking a look down the historical path, the primary school ought to be a remarkable landmark for the community, as the school, which is 57 years old, almost as old as Nigeria, was birthed in 1964. For the community, this is not the case, as the state of the primary school has retrogressed drastically, leading to a low standard of education in the community. KAFTANTV had the privilege of speaking to one of the teachers in the primary school who enumerated a number of challenges and the effect of the resettlement policy on their educational system.
Honestly, the primary school, as you can see, this community, as big as it is, we only have one single primary school here that is taking care of almost about 3 or 4 settlements. And even up to now, we're expecting those people that will be coming, that will be relocated here from town, either Jabi, Mabushi and so. So we have a lot of population. And if that population comes here, honestly speaking, there is a lot of problem. Even as it is right now, we have a lot of challenges in this primary school. And some of those challenges, in the first place, we have shortage of manpower, as in the teachers that will take care of these children, and they'll have poor facilities. We don't have enough classroom facilities that will take care of the teachers, the children, just like you have seen yourself. Some of the classes, when there's rainfall, honestly, like this one, we have to evacuate the children out because we can't keep them there. So we only use it maybe comfortably, maybe in the dry season. But this time around, that is rainy season, honestly, we can't just keep them in that class. So it makes us to choke the children in other classes. And as it is, the seating arrangement, which is supposed to be in a class not more than 35 or 40, is already abused. So learning in this kind of situation is becoming difficult. And you can see we have problem of fence. These children are supposed to have a security, and just like the country is now, everybody knows what is going on about insecurity. So somebody can just bounce into the school now and do whatever I feel like doing. So the children, the teachers, we also need security. And the fence is one of those things. And honestly, we the teachers don't have an administrative block. This is where we use, which is a class. So if at all we have an administrative block, then we can use this one for the class. Just like we have challenges, we will have moved the student down to this place, but we don't have option. So we need an administrative block, we need more teachers, we need a lot of equipment. And let me tell you one interesting thing about this school. The school is almost as old as Nigeria itself, because it was established in 1964. So you see that's 57 years, in which by all ramifications, it's supposed to be a pilot science school, but we don't have those facilities on ground. So we have no option than to use what we have. So these are some of the challenges. And most importantly, these classes and the population that is about coming here, that is where we're calling the attention of the government or whosoever that will come to our aid. Look at what we may likely face as soon as those people come, so that they will come to our aid in those areas.
The need for essential services in Shere Community is the outcry of its residents. Public health promotes the welfare of an entire population as it would prevent the spread of infectious disease and environmental hazards. A tour to the healthcare facility in Shere revealed that the community has just one clinic that runs between 8 a.m. to 4 p.m. daily, as one person cannot run 24 hours and attend to 15 to 20 patients in a day. Speaking with Christiana Kagbo, the officer in charge of the clinic, who has a BSc in public health and is also a common health extension worker, she explained that the clinic is facing a lot of challenges and as such they make use of available resources. Christiana stated that the clinic lacks staff as she only works with volunteers and they have no doctor. Due to lack of equipment and facilities, the clinic refers patients with critical cases to Buhari General Hospital on bikes or cabs as they do not have an ambulance, and as such this may sometimes lead to death due to the long distance and bad road network.
The facility is not equipped enough for us to treat the community. I have many challenges that will make me to say that it's not equipped. Yeah. The challenges is that our referral center, whenever there's an emergency, is a serious problem to us. Some people ending up dying on the road before reaching the referral center. And then because of equipment, we have to refer. And secondly, we don't have any doctor in the facility. And even the staff, too, is a problem. It's only me, the staff. I'm the only staff. The remaining are volunteers. They don't pay them anything. They only work with me as a volunteer. They are not being employed by the government. That's the major challenges. And the structure too is a serious problem. You can see what I'm doing. If you go there, the guy is working, but he's going to pray. He went to mosque. The building is leaking. In fact, the structure, but is mess. If you see how I wish rain will fall when you are here, you know what I'm saying. Everywhere, I run in skeleton with patient because it's leaking. Even I'm taking delivery. In fact, there's a day I'm taking delivery. I don't know that water is dropping on the baby, the newborn baby. I don't know. It was when I'm done with the mother and I realized that the baby water is dropping on her. So we have the building and every but the roofing is. I continue repairing it, managing it. It's leaking everywhere, and the fence too. You can see people coming in, people defecating inside. There's no fence at all. You know, our primary healthcare, you use the available resources. So when they come, now I have to isolate them based on what I have, based on the place that is okay for me to carry out the procedure. So I do the isolation and everything was going well. You know, our own key, you use the available resources. We don't stand, we don't sit because you don't have the place, the space or whatever. You provide, you see what you can do to make sure that you take care of the sick ones. And the light too, I forgot the big one. There's no light. The solar will have only serve us when there's sun. But when there is no sun, there's no light. It will affect the clinic because there's no staffs. Yes, there's no staff. And let's say like other activities where it has not been carried out in this facility. Because some of the things you will say you have to refer. Because of those departments, the doctors and the whatever, the specialists, they are not there to manage. You have to refer. And there's no staff, as I'm telling you, I'm the only permanent staff in the facility. The remaining one, they are just helping me as a volunteers. Yes, it's fun. And we don't have ambulance for the facility, nothing. When you have emergency patient, you have to start looking for means of transporting the patient sometime. In fact, there are a lot of things. Even the road, so before you get there, you know some of these our car, before you get there, if it rain, I don't know whether you have passed through the road as you are coming. If it rain.
Went to the school.
Okay, it's after the school, you understand what I'm saying. In fact, there was a time I'm taking a patient to Buhari General Hospital. Instead of going to Buhari, we are turning back again with the vehicle. You know, some of the cars, some of them, the tire. And before even that person will respond to you in the night, you have to be going head escalator to talk. This one will say he don't have fuel and other things. You go to this one. So it's a big problem. So we don't have even ambulance to convey a patient when there's an emergency.
During the course of our tour, an abandoned, uncompleted health project for the construction of 60 beds cottage hospital by the Federal Capital Territory Administration, Health and Humanitarian Secretariat was discovered. Ibrahim Hamza, who is a resident in Shere Community, Buhari Area Council, analyzed the resettlement from a different perspective as he suggests that the merger would improve the agricultural state of the community if the residents buy and sell in the community, and the attention of the government may now be drawn to them as people resettle in their community. He further divulged that there was fear of insecurity in the community as 2 police officers were kidnapped a few years back.
On a scale of 10, I would say what we have is 4, and of these 4, maybe scaling it down again to 10, of the 4 available, I would say 2% is functional. In terms of economic development, I see a lot of growth in terms of agricultural produce. People would be able to sell within the community instead of committing to Pape, because I'm sure while you were committing down here, you saw a community called Pape. That's where they go to sell. So that will bring development in terms of economic growth. It would make the people sell their produce here rather than commit to Pape to do that. That's on the one hand. On the other hand, in terms of infrastructure development, we believe that once the people are resettled here, the government will now take an interest in providing facilities, because our belief is the government for now doesn't care because they don't have any interest. Okay, so once they resettle people here, they now have an interest to protect, and that interest would drive development down to Shere. That's another. Then in terms of security, our greatest challenge is that even in places that are highly secured, you still have cases of kidnapping going on. Now, in Shere, as we speak, we've had incidents of kidnapping. I can't remember the number of times we've had that. So you can imagine a situation where security is not provided. So that would make the current situation worse. So we see security as one of the main issues that we're going to be having challenges in dealing with. So there has to be a deliberate effort in tackling that. You look at infrastructure, like I told you in the palace, the existing road as it is now, it's very difficult to commute on when it rains. It's very slippery and muddy. If it rained before you came down here, I'm sure you can't drive to this place. You saw somebody showed you the injury he sustained. It's because of the condition of the road. So there has to be that effort to curtail that. Otherwise, when you bring in more people, it will exert more pressure on the existing infrastructure, and that would mean what? That would mean collapse in the infrastructure. So we need more of that. In terms of road construction, we need a road to be tarred and constructed properly. The water supply system, like we heard, people depend on stream water and wells to get drinking water. And there's an overhead tank there. That overhead tank is not functioning properly. So you also need that to be taken care of. So unless that is taken care of, when you bring in more people here, there will be more pressure, and the infrastructure cannot accommodate the population. It's an agrarian society, and people really depend on agriculture for their source of income and livelihood. So really, I wouldn't say there are, except for the site that was brought in recently, people really depend on agriculture. But for now, you now have people who does vulcanizing, like you're seeing some guy there with the vulcanizing equipment. You have people who are engaged in charging mobile devices. You have people who are mechanics. So there has been some sort of improvement in terms of informal employment.
The presence of quarry sites in Shere Community signifies that it is a community blessed with natural resources, as trucks loaded with granite and sand can be seen going in and out of the quarry sites. A resident, Ibrahim, expresses displeasure over the bad road network, as he explained that these trucks and lorries were contributing factors. He further added that the beneficiaries of the quarry sites do not engage in corporate social responsibilities as a means to give back to the society after taking from it. The Federal Capital Territory Administration, in its way of aiding the relocation, has built resettlement houses in the community for the relocating communities into Shere.
We are worried about one thing, that if government is aware of their existence and their operation, then why is government not asking them to provide to the community in terms of what they call social, what do they call it, social responsibility? There's a phrase I'm trying to remember that is used for that, wherein you're operating in an environment, then you provide to that community. Corporate social responsibility is that what they call it. So we expect that those quarrying companies do that for us. But the challenge we're having is that rather than do that, they don't, unless the community put pressure on them, and then of course they go about laying gravels on the road. When that is done to enable them commute to town, not because they care about the community. It's for their vehicles to be able to commute on those roads. That's why they apply those gravels, and not because they want the people to benefit from that. Yes, so they've really not been doing anything for us, even though the communities have been putting pressure on them to make them see reason why they should provide those infrastructure.
Having a view of the state of infrastructural facilities in Shere, it is evident why the leaders and residents of the community are bothered about the merger and its effect on them. KAFTANTV crew was able to gather that the residents of Shere Community have said that they do not reject the government's plan for the resettlement, but they are asking for a proper compensation plan and a restructuring for their infrastructural facilities.
In that area, we would like the government to consult the kingdom of the community, that is the chief palace. We would like them to equally reserve, because we have the young ones growing and we are still burning. I mean, we are still delivering, our wives are still delivering, and our children will still deliver. So in times to come, maybe we'll have some type of problem. So we are calling to the government, as the chief earlier said, that we don't have option, but government should look at it critically to know and reserve some area for us, then the ones that they are giving to those that will join us. Government should look at it critically, because I know very well that it is not only the area that they demarcate for the settlement that is mainly for them. They are also farmers like us, and we are equally farmers like them. Then in terms of government, when the government wants to intervene now, whenever he comes, he should reserve the area and make a proper compensation to the landowners. Because we don't have any other option, hence we are accepted giving out a piece of land. When he made a proper compensation, then the land that is our mine should be bundled within our own, their own. Because we are today witnessing, or we witness some. Maybe by then we will not reach that. So the younger ones, the younger generation that will come should witness and have a concrete record for some type of activities.
And that's all we can take this week on Abuja File. Join us next week, same time, on news, events, and happenings in the FCT. My name is Sandra Ago.